Hi everybody. Good morning on a Saturday morning. Today we are going to have the live session with Anupama Das. She was one of our instructors at Yoga Vahini, a yoga school in Chennai. Let me just connect her 1 minute and then we can talk more about her. Thank you, Anupama, for joining. I feel we are all part of the same lineage of Krishnamacharya Yoga. She trained in Krishnamacharya Yoga Mandiram at Mandavalli in Chennai and went on to again work for many organizations across in Chennai who are into teaching yoga and giving yoga as therapy. And one of that was Yoga Vahini, where I met Anupama. And all these accreditations and her experience apart, she's one of the most calmest teachers I have. I mean, yoga teachers are public understands them to be having to be calm. You know, you can't be like a hyper and be like a yoga teacher. That's like an oxymoron in everybody else's mind. But Anupama truly is extremely calm and composed, and I have never seen her ruffled at all, actually. And she's been a great mentor to some of my friends who are part of training with me. So anyway, I don't want to take up too much time. Thank you, Anupama, for joining. So the reason why we are having her today, and we'll be doing more of these sessions going forward on other Saturdays of this month, is yoga is celebrated June. In June, we have International Yoga Day. So I think the one running joke among the yoga community is for us every day is the yoga day. There is no one particular yoga day or a yoga month. But this is a good time to talk about it and to talk about the kind of yoga that we practice or we believe in. So it almost becomes like an excuse to talk about a daily practice which all of us strive to aim for. So over to you, Anupama. Can you tell us a little bit about the kind of yoga you practice and you teach and as a therapy?
Sure, Sudha. Thank you. So, as you rightly said, I think yoga is basically a discipline. Traditionally, it's not something I do someday, I don't do other days. It's something we follow through our lives for as long as we can. So, it's not just about the physical aspect of it, though that's the most common and most popular aspect, what we call asanas.
Yes.
So, you were asking about the tradition that is followed, that I practice and teach. So this is called the Krishnamacharya tradition of yoga. And Sri T. Krishnamacharya was the one who advocated this style of yoga. We have to say styles only because today there are different kinds of yoga to differentiate this between others. Right? So one of the highlights of the uniqueness of this particular tradition is the importance that it pays the individual. It's not like one size fits all. So it's great for using this style for therapeutic work only because, and even otherwise, only because the individual is respected at every level.
Right.
Every human being is the sum total of a lot of components. We have the body, we have the mind, we have the emotion, we have the breath, we have our lifestyle, we have our relationships, the way we understand life. Right? So this is just about that person and how we bring them back to a point, what we call prakriti, or what we call, coming back to a sense of balance. So
Correct.
this I would say is the uniqueness.
Uniqueness. You're saying so it's very individualized, very customized to each person.
Absolutely.
And it doesn't stop with just the bodily aspect, which is what we call as asana. And now there is on International Yoga Day, we can see a lot of pictures of people doing one particular asana in one pose. While that makes me very happy to see that, but there is, from what Anupama is saying, there is a whole, you look at an individual as a whole, mind, body, breath, lifestyle, how you do, what you eat, everything is a part of yoga. Now, tell me, Anupama, like what we were discussing something from yesterday. If a person comes to you, say, let us take the example of Parkinson's, because we have a lot of members being afflicted by this neurodegenerative disorder, which cannot get better. So, something in which mobility is deeply affected, or where they're in extreme pain. When they come to therapy in yoga, how do you look at somebody like that?
So basically, from the yoga therapy point of view, it is still about the person. It's just that it depends on the symptoms one exhibits. So we ask them a whole lot of questions about how you're feeling, what are the symptoms you're experiencing. So for some people, it's a question of balance. For some people, it is tremors. For some people, it is constipation. But then if you look at these symptoms, devoid of the name or the term or the label Parkinson's, there are even others who can have a loss of balance,
Right.
who can have constipation, who can have tremors due to various other reasons.
Right.
So possibly the way this helps is when you give the name of maybe a condition or a disorder or an issue, there are a certain number of kind of symptoms that can possibly be exhibited. But here again, it is not about every person with Parkinson's or every person with diabetes will have the same symptoms. There again, it is dependent on the person because the age is different, their capability is different, their likes and dislikes are different. The people who are looking after them, the caregivers, are also different.
Yeah.
So we have to consider the human being in their totality, in their environment, and what is their life like, and then only go ahead with, suggesting what would work for that person.
Exactly. So you're saying even when they come, even if there is a name to the disorder, right? You can expect some symptoms coming from it,
Right.
but you're saying, but still, a lot of other people can still be having constipation, which is like 50% of the problem in Parkinson's. So anybody else with constipation, as a yoga therapist, you will deal with them in a different way based on their lifestyle. What are they eating? When are they sleeping? What is going on? So just because they have PV or say they have dementia, it's not like you will treat them any differently, but based on the person. That's very individualized, is what you're saying.
Absolutely.
Right. How much of, okay, another common misconception or an issue with yoga, or rather the term yoga itself, I think we can spend time talking about what is in fact yoga. But keeping that aside, let's assuming that yoga is for the time being a lot depending on asana and pranayama. Is there something that people can do and then not fall sick? Because, oh, you're doing yoga, but how come they have Parkinson's? I have been a practitioner of yoga for so long, but then I have this issue. This comes up a lot. Sir, na romba healthy, na nariya meditation practice pandra madam, but I have Parkinson's. So this is a very common occurrence among our members and even outside. What would you as a teacher say for something like this?
Okay, so there are some things that yoga can do or reverse. There are some that you can't handle or do. Nevertheless, yoga has its own benefits. Now, there is one component in all of this, which is the genetic component as well. You have inherited a certain, kind of body with a certain streak or a DNA or whatever.
Right.
Now, that part of it is something that you cannot reverse.
True.
That is inherent in the person, right? And then there are other factors. It's like saying, I do yoga every day, but I fall sick or I have stomach issues. Now, my next question is, where do you eat? What do you eat? Do you follow a sense of hygiene?
Yep.
It's not about the asana or the pranayama. It's a question of how you're leading your life in general. So you minimize all of this. But if a bacteria or virus has to get in, it will anyhow.
Correct.
Right? We don't have that kind of hold over these things.
Yeah, I like that. So you're saying we all are subjected to our genetic composition, on which yoga cannot, or at least asana pranayama practice cannot completely radically change what is inherently we are born with. And two, there is so much stimuli from external environment where we live also. Even assuming that we eat very healthy, quote unquote, I don't know, whatever that is, and then lead a fairly decent lifestyle in terms of sleep and food and discipline, but still there are a lot of environment factors that will affect it. So just because one does asana pranayama regularly does not mean that one will not be subjected to the conditions of the environment or the body itself that you're born. But you're saying yoga itself or asana pranayama can itself taper some of these issues that come. You can deal with these issues as and when they come.
You can deal with your life better once you start doing yoga. You can deal.
Yeah,
it may not change everything. Right? For example, there's a person who's leading a very healthy lifestyle, getting up at the right time, eating the right food, doing the right kind of exercise throughout, but who had a heart attack and died at the age of 40. Now, what do you say about that? Versus a person who's a chain smoker, drinker, who had 2 heart attacks, but who's fine even at the age of 60. Now, as per the doctor's diagnosis, his heart was very strong. Now, that
Yeah.
is the genetic streak he has inherited.
Right. Right. Exactly.
So here
Exactly.
lies a little difference, and I think the main point here being that with yoga, we possibly can have a better quality of life overall.
Better quality of life. That's great. So it's not like a cure-all and the end of all sorts of disorders, mental, physical ailments that one goes through. But whatever one is subjected to naturally or through environment, you can deal with things better if you practice your asana pranayama and also lifestyle. Now, asana pranayama, one question on this, Anupama, and then we'll move on to non these. Okay. So there is always, if I tell that I practice yoga, most people who don't practice asana, they will be like, so can you do a headstand? Or can you do a shoulder stand? For them, asana is that, right? Unless you do something really complicated and tough, what benefit would you get in just, raising your arms up and down? What would you say for something like that?
Yeah, I think there are various components to yoga. And like I said, the most popular one that is being advertised, let's say, currently is asana, about physical postures, about the complexity of doing it. But there is a reason. Now, we follow Ashtanga Yoga, the traditional Ashtanga Yoga, not the brand, which deals with the Ashta Angas or the 8 limbs of yoga. And part of the 8 limbs is asana and pranayama. Asana relating to physical postures, which basically are postures that are supposed to help you to have a healthier physical system, physiological system.
Right.
Now, pranayama deals with your breath, breathing techniques. So, in cases like, let's say, asthma, certain breathing techniques work very well. We might use that. Now, before these 2 components, we also have 2 more, the yamas and the niyamas, which are attitudes. Now, we never talk about this,
Yes.
but they come
Yes.
first.
Yes.
And if we don't have a good attitude to life, like a non-violence, speaking the truth, being contented, not taking things that don't belong to us, not hoarding things, if we don't have it, no amount of asana pranayama is going to make us feel happy.
Right. You might be able to do the headstand still, but you could still just at the drop of the hat, like snap at people and then maybe regret
Yeah,
or
you
not
may be
later.
an unhappier person
But
overall, whereas somebody who does not do any asana
exactly.
may have a better quality of life, may feel more peaceful,
Yeah.
have a
Yeah.
better outlook to life itself, possibly.
Right. So, yeah, it doesn't matter what physical aspect alone is practiced because it is 8 limbs of yoga, as you said, Ashtanga yoga, which itself, as again you said, it's a brand of yoga now. But in fact, according to the yoga philosophy, it's the practices that one has to follow. It's a lifestyle and the way you lead your life in terms of in the yoga traditional way. Now, going to this, it's a good segue that you said. Now, I want to move away a little bit from asana pranayama. When you get students, of course, you will ask them about their condition and what is bothering them currently. What is the way or the manner in which a yoga teacher, say, looks at a person rather than, like, say, a physiotherapist or a doctor looks at a person? How you said you look at a person whole, but in what angle? Give me an example for somebody you have dealt with, say, with Parkinsons. Again, they come to you. How do you look at them?
Okay, I think we will segregate this as the allopathic or the Western perspective versus yoga, right? So, from a Western perspective, it's more or less dealing with the disorder. You do have a whole lot of medication, which is important to bring a sense of balance in that person's life. Yeah, so certain kinds of medication are there to reduce certain symptoms like your tremors, maybe depression, whatever the person undergoes. Now, here we try to empower the person. So, here is a big difference in yoga, in this style at least. Somebody else is not doing the job for you. You have to do it. You put in the work, you put in the effort, but you do it in a manner where you're able to take care of yourself better. You understand yourself better. And it's
like
not
that.
just about the physical aspect, it's also about the mind. Because let's say in a case like, say, Parkinson's or epilepsy or depression, the mind has a big role to play in this. And it's not about that person alone, but the people around the person who's, either suffering or going through this whole thing. So, as a yoga therapist, we look at the person and the person's environment, their life, their relationship with people, everything, and see how we can give them a better life overall, bringing that quality, which means you'll have to take care of the mind to a great extent. Once the mind is taken care of, a lot of things don't seem as big or, as bad as it seems sometimes.
Yeah, I like that. I like what you said about empowering people to take charge of their health. You're no longer dependent on a medicine or an external force, but you know that with your practice, you can strengthen your mind. Hence, you have the ability or the strength to deal with either what is already there or make it better, one way or
The
the other.
other thing here, Sudha, is also the connection you have with your own body, right? When you start understanding your body better, you're able to understand, deal, do things that are good for it. Right?
Right.
See, most often we eat, we sleep, we do a whole lot of things unconsciously.
Right.
But here it is a very conscious experience. So when something happens, there is a certain symptom exhibited, you
Oh,
might be able to understand what is happening.
right.
The other
Right.
thing is, all these symptoms, whether it is constipation or tremors, can happen to anyone. So we are not dealing with a person with Parkinson's. We are dealing with the ability to steady the hand, ability to walk better,
Mm,
ability to do something better. So it's
right.
mainly about, like I said, bringing the person back to their prakriti, or their to a space where they feel good. So it's
Correct.
overall well-being to a great
Towards
extent.
overall well-being. You take them to a place through practice where they feel good, and from that, action emerges. And then whatever symptom that needs to be addressed will be taken care of through that. It's
Right.
not like you're sitting and designing a program, oh, I have to reduce tremor, I have to reduce constipation. It's not like ticking one thing after the other. Because that's why I find when we do a review or when we look at other studies based on yoga and Parkinson's, there will be manual of what postures were used. This posture helps in this, does not help in that. It's very difficult to say because it affects, I have seen it personally with members, each one affects members very differently. And together there might be some result, but it's very hard to pin down and say you did this posture, hence this. There is some general guideline, but it's very hard to pinpoint one or the other, I think.
Yes. And because this is so individual centric, it's
Mm.
not like dealing every person affected by a certain health issue in the same manner. Because
Exactly.
people connect with certain tools better. Some people need more asana, some more pranayama, some less asana,
Mm.
meditation, chanting. So many things are there.
Right, right,
So it's
right,
really about understanding that person,
right,
their psyche,
right.
their likes, their dislikes, and other things, based on which
True.
the tools of yoga will be used.
Yeah, as you said, there are many tools. What speaks to them, what works for them. Ultimately, the result is you feel good here, so it translates into how you're feeling in your body. Give me now like a tangible example of somebody you've worked with PD. Say how they were when they came to you, and if you saw any changes over the course of therapy with them.
Okay, so there is an individual who's been coming to me. Uh, Now, the gentleman is about, say, 76 years old, and had issues with balance. I would say predominantly that part of it was taken care of through medication. But the
Mm,
larger aspect in all this was the person stays alone. He's an individual, all alone, a very social person whose wife passed away, daughter's not here, nobody's there with the person. So a lot of depression and anxiety had set in.
mm,
So when I first met this person, uh, I think the main aim was to make him feel better about himself, increase self-confidence, self-esteem, ability to do things on his own without thinking, oh, I'm lost, now nobody is here, right? Just bringing that sense of faith in himself, and of course do some amount of yoga through the various tools that we usually use to make sure that he's able to walk better, his limbs are working better, take care of his memory, because I can see that is affected. So over the last 3 or 4 years that he's been with me, I can see that the memory is fading a little bit, but it's not as bad as it was earlier.
Like you mean
And the
mental?
mentally, ability to remember, ability to, connect with things. But he feels much better overall, he says. His outlook to life is very different today than when he started yoga. And he feels yoga has really helped him because being a social person, an extrovert who has no one staying with him, it's very difficult to deal with what he's going through, right?
Ah.
But today, he doesn't look at the world cynically.
Mm.
He's able to feel that life is not that bad.
Yeah, see, that's the whole change in outlook that he had with the practice. So
Right.
this is, of course, you're saying that there must be an impact on the physical body also. He must be feeling better to feel mentally better also. But it's not only about is his constipation better, is he sleeping better, but his outlook towards life has changed. So I think that's a whole big another impact of, totally a different impact of yoga. Now, one particular question before I let you go, Anupama. Lot of people, I feel, mistakenly feel if they do yoga, they don't have to take medicine. There is some amount of this in Parkinson's, but a lot of this in other minor ailments also. இல்ல நான் யோகா பண்றேன். எனக்கு no need for medicine. As a teacher of yoga, what would you say to something like this? Because it's a two different, you just told how allopathy looks at an ailment and how from a yoga point of view it's very different, and now this is a little bit of a mix of both, right? One takes medicine and there is a different cure, and here you are practicing something else. So would you negate that and then say don't do that, just do this practice, it will be good for you?
No, never. So we don't interfere with what the medical fraternity has to say because they are qualified with a certain field. They know what's going on internally. We have to rely on that diagnosis to understand the individual to some extent in terms of what's happening inside them. But we work alongside that. So for all the medication that is given, there will be certain side effects. Right? Even if I have issues with my stomach, let's say somebody has IBS, irritable bowel syndrome, and they take medication for a long time, or somebody has depression, antidepressants, there is a certain side effect.
Right.
We try to see how we can work in a manner that through certain tools, maybe some asana, reduce constipation, give them suggestions about lifestyle changes, the kind of food they should eat to make sure that, both are balanced. So we work hand in hand with what's happening in terms of the medication part of it, but no, they cannot, and we do not tell them not to have any medication. They have to, because medicines have a certain job. There's a time and place for everything.
True. True, you can't like not take medicine because lot of times, not even asana pranayama. I have heard members who say, "Na meditation பண்றமா எனக்கு அது போதும். I don't need Sindopa, I don't need PD meds." So that would really send me on a panic mode. So this is very good. So it seems like from whatever you're describing about yoga, it seems a little bit like a water. It takes the shape of whatever container. It's very fluid in my mind from what you're saying. There are no restrictions about shoulds and should not in terms of other forms of treatment, but you're saying we'll work with the individual in such a way to see how we can make them feel better mentally, and that percolates also into how they'll do physically well. And you're not treating an ailment, you're looking at a person as a whole. What environment they come from, what do they eat, what is their lifestyle, and what problems they're facing, and how can all of this be addressed in a holistic manner.
Right, absolutely. See, for example, a person comes with asthma, we teach them certain, let's say, pranayama techniques. Now, there are instances where we feel the person is better and can, go back to their doctor, check medically, and see if they can be weaned off or the dosage can be reduced. We don't do it.
Yeah.
It may be a suggestion because of the symptoms that they're exhibiting. So that's the extent to which we can go, but we never tell them don't have any medication.
They don't have it. Yeah. I have also seen many times the medication levels are reduced, or the space of medication is increased between one med
Yeah,
to the next. Yeah, things like that.
absolutely.
Sometimes you have to rely on it, but you can slowly wean them off, and maybe at an emergency, if they require, they can always go back to it. Also, parting words, anything that you would like to say on what is a daily practice of yoga that just people have to remember? What does yoga mean in general?
Yeah, like I said, yoga is a discipline, something you do every day. So the best person to tell you what to do would be your teacher. Right? So you have a teacher who would look at you as a whole and give you something that is appropriate. It is very difficult to say, do this asana or do this chanting or do this pranayama, because it's going to be different for every person. But if you
Right.
have something like that, or you're able to connect with a teacher who's able to understand you, I think you would get a very good practice. You can follow that, and it will really take care of your mind, your body as well.
Wow, true. Very well said. Thank you, Anupama. Anything else
Thank
that
you,
I've missed
Sudha.
out that you would love to say?
No, I think, it's good for us to understand that, the human body and the mind is something that changes over time. Yeah.
Yeah.
So if we have any expectations that this is how we are going to be every day of our life, that's a little, uh,
Ah,
you know, uh,
very.
difficult, because we will age. There is a certain amount of degeneration that will happen, whether it is wrinkles on my face and no health issues, or some amount of dementia, whatever. It is an aging process. And I think
Right.
if we all have a sense of acceptance and a strong mind and a positive outlook, a lot of things can even not manifest physically, because the mind and body are so closely connected. If we can have that zest for life, enthusiasm, and acceptance to whatever comes our way in a positive manner, I think half our job is done.
Fair enough. So anybody watching this or who will be watching this in the future, go find a good yoga teacher who will be able to guide you with the daily practice and keep with it. It will help you deal with the challenges that anyway come up in life, not just in your body, but even whatever the life has to throw at you. Thank you, Anupama. This was really wonderful chatting with you.
Thank you, Sudha.
Yeah. Bye. I'll
Take
stop the
care.
live now.
Yes, sure. Bye.